Hi, John Jesse with the Health Continuum here today with another in our series of Ask an Expert. And today we're talking about a very exciting topic, blood flow restriction, or BFR as we're going to refer to it. And my guess is you probably haven't heard of it, and probably very few of you are using it. Our goal is to change that today. And we have a renowned expert with us, Dr. Sten Stray Gundersen. Welcome, Dr. Gundersen.
Thank you so much for having me on. It's a pleasure to be here.
Let me tell you, Dr. Gundersen is assistant professor of exercise science at the University of South Carolina. He specializes in human performance, recovery, and blood flow restriction training. He spent more than a decade researching how BFR, intermittent hypoxia, and targeted cardiovascular training can safely improve strength, aerobic fitness, and overall health for people of all ages. Sten grew up immersed in sports and performance science and competed as a lifetime athlete. Wow, he was a Division I soccer player, successful. His work blends the cutting edge of physiology with practical real-world application, and he collaborates with clinicians, athletes, military, and everyday individuals to make BFR and other science-backed methods accessible, safe, and effective. And his aim is to translate this complex science into simple, actionable strategies that help people feel stronger, fitter, and more resilient. And that's what our goal is on the Health Continuum. So, Stan, tell us a little bit about yourself and how did you get into this field and become an expert in BFR?
Yeah, briefly. Thank you for that introduction. That was great. I was really introduced to this through my father. My father was a renowned exercise physiologist with an MD background in the early and late 90s. He developed the Live High, Train Low protocol, which is used almost unanimously by a wide range of athletes to improve performance in their competition. The idea in that case was to live at high altitude, be exposed to low oxygen, but maintain your training intensities by performing those high intensity training sessions at low altitude. In so doing, being able to boost all those aerobic adaptations that you get from living at high altitude, but then really maximize the performance and maximize the force output from the muscles to be able to do that at sea level. So
he was a brilliant scientist and practitioner,
yes,
wasn't he?
yeah, absolutely, and a heck of a father as well. I mean, I just feel very lucky to have been his son, and then been within the very high sports performance realm from a very young age, and so that was always an interest to me. All the kids had aspirations to be Olympians at some point. We ended up going sort of separate paths. Most of us played soccer. And as you mentioned in the introduction, I played 4 years at Dartmouth College, had a very successful career there. That's actually what kind of led me into this field. So I was very interested in physiology, the physiology behind exercise, behind adapting to exercise. And I was able to play with BFR as an athlete and use it to enhance my training and recovery as well. Shortly after my collegiate career, I was bouncing around different teams in the USL, which is a semi-professional league here in the United States. I was bouncing around different teams, got injured. I actually had a grade 3 MCL sprain, PCL, LCL, as well as my meniscus. And during that time, we've been using BFR for performance. And so my dad and I kind of got together and said, okay, how fast can we actually heal this injury? No surgery required. I was right on that threshold of needing surgery or not. And so we applied multiple modalities, but chief of which was blood flow restriction. And so the sum of that story is that I was able to get back into running shape. Within 6 weeks, I was running on full body weight. And in 8 weeks, I was able to play soccer. Now, I wasn't able to play sort of in a very competitive environment during that time. I was still sort of nursing that injury, but I was functional in 8 weeks, which is a massive improvement in recovery time than it normally takes. And so that was really the sort of aha light bulb moment for me. And I thought, okay, let me really dig into what's going on here. Let me kind of further my dad's research. And so that led me to get a master's at the University of Texas, Austin in 2017. I just developed a passion for research, and so I ended up pursuing a PhD there as well. And then 2 years ago, I came to the University of South Carolina for a postdoc for further training, essentially, as if after a PhD you need further training. And then a job opened up here to become an assistant professor. So I took that job and ended up acquiring it. And I've just recently started my lab in January.
Oh, how
Very fresh. And
how
yeah, so it's very,
exciting.
very fresh and new. And I'm trying to move the field of blood flow restriction forward. Right now, I would say there's been an explosion of research in the last 10 to 15 years. And so to watch that wave and watch that increase in popularity has been an awesome experience. And I'm just happy to sort of disseminate the word that is blood flow restriction, because I think it can impact so many different people's lives and really lead to positive outcomes.
Well, so let's see if we can move this passion of yours ahead today. Take us through just a quick overview, small words,
Sure.
high level.
Yep.
What is BFR? What is it exactly? Just a quick overview so people understand
So
what.
yeah, so first, from a very literal standpoint, what you're doing is you're applying bands or cuffs onto the proximal portion, meaning the upper portion of the limb, and that is on the both the arms and the proximal portion of the thighs. And by doing so, what we're doing is partially restricting the arterial inflow, or the oxygen-rich blood, to the muscle, and then intermittently occluding, meaning completely stopping at certain time points, the venous outflow. And so what that does is really it causes what we describe as a disturbance in homeostasis, and accelerates fatigue. So that when you use light weights paired with this blood flow restriction, it will accelerate your fatigue response and trigger what we know high intensity or high load exercise does, which is cause that disturbance in homeostasis and trigger the brain to release various hormones to then help the body recover from that exercise session. But because we're using light weights, there's very minimal actual recovery needed. And so you can really ramp up what we call that anabolic response to that very low load or light intensity exercise.
So let
So
me
if I were to say this sort of in summary, it's a way to accelerate fatigue and elicit all the benefits of very high intensity exercise using low intensity or low weights.
So just as example, so I'm doing overhead presses, maybe rehabbing my shoulder, I got a band, and if I'm doing 25-pound weights, it would be like I do 10 reps of 25, but I'm getting the benefit as if I'm doing 10 reps of 50. I mean, I'm getting more benefit than what I'm putting out. Wow, that sounds like high level interest on an investment. I mean, who wouldn't want to do that?
Absolutely.
So if you're an average non-athlete and maybe a mature athlete, a lot of our folks are in those mature years. Talk to them and tell them why and how
Yeah.
would they go about using BFR in their as part of their fitness plan. Let's talk about fitness plan first, as
Yeah,
opposed
sure.
to injury prevention or injury.
Yeah, so taking it from a sort of a non-athlete sort of context, athletes use this as a way to sort of augment or use this as an adjunct to their existing training, which is totally suitable for the population that you described as well. But if I could sort of recommend a general protocol, I would be performing BFR 3 to 4 times a week. And what's nice about BFR is these sessions really only last for 15 to 20 minutes. So it's very time efficient, and it's really great for travel. So when you're out traveling, you have limited equipment. It's a great way to get a very robust workout without the excess time and recovery needed from relatively high intensity exercise. So this is truly, the biohack sort of term has been thrown around quite a bit. This is truly a biohack for high intensity exercise using low intensity kind of stimuli. And so just one caveat there, there's no free lunch in this world. So the relative intensity, meaning your effort, needs to be high, and it's not exactly the most easy form of exercise, but is really taking otherwise easy or trivial exercise and making it intense. And so we can really ramp up the intensity without necessarily incurring that cost of that intensity.
I'm glad you mentioned that it does travel. I've taken it throughout the United States. I didn't take it to Italy this summer because I was worried. Oh man, what if they confiscate this? It isn't worth it.
Yeah.
So I didn't. But I travel with it all the
Yeah.
time and can use different kinds of weight training. You can also use it for cardio training, like cycling or walking or
Yes.
running. Talk about that for a second.
Yeah, there's been actually many studies showing that even, low grade uphill walking can actually confer increases in VO2 max while also at the same time building muscle. So that's a really interesting and unique aspect of BFR, is that you're able to actually stimulate strength gains as well as aerobic gains, and benefits to your cardiovascular system. And so one way to do that, you can do sort of that zone 2 or even zone 1 type intensity and perform this with BFR for about 15 minutes. And you are boosting a lot of those increases in aerobic capacity that we associate with that high intensity interval type training. And so it's a great way to pair it with cardiovascular training as well as strength training.
So I can use it with my cardiovascular if I'm doing strength training, say 2-3 times a week. I can do the same strength training, use the BFR, use the bands, might have to lighten my weight a little bit because it does make it
Yes.
much more difficult. Believe me, I can tell you that I
Yes.
hiked up a hill this morning that I'll run up that hill, but I'm not it's just so difficult to run up it that I can hike up it and get
Right.
the same benefit as if I were running up. I mean, it's a pretty steep hill, but that's it's amazing to me. Are there certain folks that you'd say it works better for? That, oh yeah, this is the kind of profile where this is really going to make a difference.
What I would say to that question is that it has different applications for different people. But it really, this, what's really cool about BFR is wherever you are on that spectrum of fitness, it can really give you a robust stimulus to adapt. And so whether you're someone who is very unfamiliar with exercise, you're just getting started with the training program, this is a great way to sort of introduce that exercise slowly. Because you're using light weights, things like technique are less injury prone. And if you're on the other end of the spectrum where you're trying to really trying to sort of tease out that little extra 2% or 5% in your performance, this is a great way to add it to your existing training. So there's a broad range of applications here. If I had to choose kind of one really good population to use this for, it would be sort of the 40 years and older group. Partly because a lot of those people are broken down from lifting heavy. Their joints just simply can't take that much load anymore. This is a great way to not be sore, not have your joints sort of broken down, and which affects other lifestyle daily activities. So this is a great way for that older population to get that high intensity stimulus without actually needing to expose your body to those very high intensity loads.
Wow. So I can get strong, keep my muscle mass in place, or even increase it without the risk of tearing down on the wear that. So it's kind of like a lot of people think, oh, I can't go in the weight room. I can't do this. I can't do that. But now you've got a way to greatly lessen the risk and still get that out. But it almost sounds too good to be true, honestly. But
Yeah,
it's not.
does.
It's
Yeah,
not.
it does,
Is
and
there,
actually there's a lot of I was gonna say there's a lot of skepticism early on with, how can these light loads actually be inducing these responses? But, the last 20 years of research have really confirmed that this is legitimate, and it is a great way to elicit those really big increases in exercise fitness.
It's pretty amazing. I've been using it for a few years and was a little skeptical, but read the
Yeah.
research. I'm a science research back guy, and the research was pretty clear. And it really does work. Is there a group of folks or any type of person you'd say, this is probably not something I would recommend?
So, yeah, on that note, and there's many different products of BFR out there. The ones that you really want to look for are the ones that have a built-in mechanism to prevent arterial occlusion. So we don't want to ever actually occlude or stop flow through the artery. We want to
Like
actually
a
maintain
tourniquet.
that
You
flow.
don't want a tourniquet
Like a
effect.
tourniquet, yeah, anytime you're creating what we call ischemia or lack of blood flow, that's what we want to avoid with blood flow restriction. So basically, any contraindications associated with blood flow restriction have to do with preventing arterial occlusion. As long as you're preventing arterial occlusion, it's a very safe form of exercise. There are some relative contraindications, things like a history of DVTs, other cardiovascular issues have been raised. But again, this has been used in those populations successfully and safely as long as they're abiding by that lack of arterial occlusion. And in fact, this can actually promote a healthy vascular function. So it actually may improve those risk factors later on after you've been training with this for a little while. The
Okay.
one real absolute contraindication is a sickle cell disease, but often those people cannot exercise at all. So
Sure.
as long as your physician has cleared you to exercise in general, BFR will be a safe thing to do for you.
Okay, we've talked about using it for just our normal workouts, improving health, but a lot of the research and the use of BFR, as you indicated in your personal experience, is injury rehabilitation.
Mhm.
So I'm going to
Yeah.
guess. I'm going to guess probably a third or more of our listeners will have this kind of issue. I got a knee problem. Maybe there's some arthritis. Maybe there's a torn meniscus. But I mean, I'm not going to get surgery. Doctor says maybe I should get physical therapy. Tell us, how could BFR help with this kind of rehabilitation?
Yes, absolutely. This is one of the most, as you pointed out, one of the most researched applications of BFR. And the reason for that is that those patients or those people, those folks cannot handle the heavy loads that you really need with strength training. Their joints simply can't deal with those loads. It's actually contraindicated. They're told to avoid really a lot of heavy strength training because it'll flare up various symptoms. And so this is a great way to actually maintain that muscle. At the same time, because of the nature of blood flow restriction, you end up fatiguing those stabilizing muscles. And those stabilizing muscles are very important for maintaining the knee integrity outside of the actual ligaments and tendons involved in the knee. So building up the musculature around the knee is going to be very important for mitigating some of those symptoms. So one kind of use case would be If someone has some impairment in their knee, they have soreness, they have stiffness in their knee, performing 3 to 4 days of training with BFR, doing sort of knee flexion exercises, building up the hamstring muscles can really help improve outcomes and improve symptoms. And on a personal note, I've actually dealt with this, as I kind of mentioned in my initial introduction. I actually suffered from a pretty traumatic knee injury during playing soccer, and I use this to rehab that, and I use it daily now to help manage those symptoms of the meniscus issue. And so, really, one of the things that is nice about BFR is because you're eliciting that hormonal response, you're actually accelerating healing, and you're promoting healing of the tissue without actually having to break that tissue first. So we're really starting, instead of starting from sort of this hole and having to dig ourselves out to get better, we're now starting at wherever we're at, and we're just improving upon that point. This really helps manage symptoms of pain. There's actually been documented that there's a hypoanalgesic effect from BFR. So you actually increase your endo-opiate production as well as your endocannabinoid production to help mitigate those pain responses. So from a daily pain management of those things, this can be a very useful tool. And the last thing I'll say is that there's actually been evidence to show BFR can enhance connective tissue healing as well. So it was previously thought you really need that high load to really stimulate the ligaments and the tendons to adapt and get stronger. But BFR has been shown to improve Achilles tendon, ACL, MCL, as well as the meniscus itself. The issue with the meniscus, which makes it hard for recovery, is that it has very limited blood supply. And so one of the nice things about BFR is that because you're restricting blood flow on the back end, you're actually promoting increases in blood flow into all the nooks and crannies that you would otherwise be hard to reach, like the meniscus.
Wow. So if I'm talking to you folks, you've got this knee problem. And first of all, you need to go read my or listen to my blog about the problems with knee surgery. After you read that, here is an alternative for you to consider. You can talk to your doctor, your physical therapist about it. Some physical therapists, only about 40% use it, which amazes me since 90% know about it. I don't know quite what we need to do about that. Or you can also pursue it like I do. You can do it at home. You get a system. So let me just tell you, this is something you really need to consider if you're suffering from knee pain. It can be part of your solution moving forward. I have a question. It's so good. It's so powerful. I know that because of the research, but I know that because of my personal use. It just amazes to me. So why have most of these folks listening have never heard of it for today, probably? Why has it been? I know it started in Japan in the 60s and then it's moved over here, used a lot in rehabilitation. It was used with high level, expensive equipment in physical therapist locations, but not tons of them. And now it's been available for some years for individual use. It doesn't seem to still be, it's not the next big thing yet. Why do you think that is? And what do you think that's going to change in the future soon?
Yeah, that's a great question. I think what's encouraging is that I've seen a massive increase in popularity over the last 10 years. So if you had asked me that question 10, 15 years ago, I would have maybe had a different answer. I think nobody has kind of heard about it back then. But more and more popularity has been gained in recent years. And so, like to your point, a lot like 90% of PTs know about this. I think it's the application. And sometimes the term blood flow restriction sounds kind of intimidating or kind of scary. And if you're not familiar with the term, or if you're not understanding of the cardiovascular system, you might say, okay, well, that sounds great, but maybe it's not for me, or maybe that seems a little unsafe if I'm not being supervised. To your point, I think one barrier to entry was the fact that this equipment was originally very expensive. And it sort of prohibited the average user from actually purchasing a personal unit. But since then, there's been a huge increase in products that are more affordable and with stepwise protocols to make sure you're doing this in a safe way. And I just have to shout out Be Strong, because Be Strong is a way inherently through the design of the band can actually prevent arterial occlusion, meaning that all the way up to our maximum pressure on the bands, you cannot occlude the artery. And so people can rest assured by performing this without a whole lot of knowledge around cardiovascular physiology that they can do this in a safe way.
And I'll put
So to
I'll put that contact information in show notes. If you're interested, you can reach out to those folks at Be Strong. That's the ones I use now. And I'll tell you, let me just say this, folks. If you have issues that you're rehabilitating with a knee or a joint, you really need to look at this. If you want to get stronger, you want to get more fit, but you don't think you can work any harder, you don't need to. In my book, I talk about there's no magic bullet. everyone's looking for a
Yeah.
magic bullet. There's no, it's a bunch of little small things and put together gets to a critical mass. This can be one of those pieces. And if I sound like it's because it works. So thank you for helping us understand. And maybe we'll have you back again as if you have questions, if you have specific questions about, hey, he didn't mention this or how about this, please send those in. And if we get enough of those, we'll reach out and try to convince them to come back. I like to ask always of our experts in particular, if you were to be able to give our listeners one piece of advice, separate from BFR, but one piece of advice, one thing that you think that everyone should think about doing today to improve and sustaining their health, what would that be?
Yeah, I think critically, exercise is a fundamental part of life. It should not be viewed as a, nice to have. It should be viewed as brushing your teeth. It should be normal personal hygiene and a part of your life because it is so vital to our system to maintain strength as well as cognition, metabolism, all these different systems that we know are affected by aging. It is critical to move, and the reality is you don't have to move much to make a big difference. So I think a lot of people get intimidated by exercise programs and things like that. My advice would be to start small. Start with a daily walk and then kind of progress from there. But you'll very quickly find that if you focus on your exercise, making sure you're getting daily movement, that then bleeds into other positive lifestyle behaviors, like then focusing maybe a little bit more on your nutrition or maybe focusing a little bit more on your sleep, on your relationships. And so it really has a very positive ripple effect in your life. And so that's what I would just encourage everybody to do with or without BFR is just move more, stay healthy, and have a good life and that you're proud of and looking to go forward with.
Well said, Sten, and thank you for your time together. To you listeners, as always, I need to ask you this. What are you able and willing to do today to begin to improve your health? One strand, one change, that's all it takes to begin you on your road to improve health and fitness. Well, maybe it's BFR. And please don't forget to mark subscribe. It'll help us spread the word. This is John Jesse with Health Continuum. Have a happy and healthy day.
Thank you.